Hello, my name is Leah, and I will be your patient care coordinator throughout this process. We may have already met during your consultation. Welcome to your rhinoplasty pre-op video. Please take out the packet that we've sent you ahead of time so you can follow along as we are discussing things. The purpose of this video is to prepare you for rhinoplasty with Dr. Funk. We recommend you and the person who's taking care of you both review this video prior to your pre-op with us. So when you come in, you will know what to ask and know how to prepare for your pre-op appointment. We'll meet in person, and at that point, we'll emphasize a few things from this video. The day before your surgery, you will start one medication that comes in this box. You will start this the day before surgery after a meal. Please follow the instructions on the back of the box as we use this for bruising and swelling. No food and drink after midnight the night before surgery, and no food and drink that morning before surgery as well. Arrive the day of surgery at the time you were informed. If you are a female, please do not empty your bladder as they will need to give you a urine pregnancy test. When you arrive the day of surgery, you'll check into the business office where you may have to clear up a few things with them. They will move you back to pre-op after that and start an IV, get you in a gown, and you'll meet with anesthesia. Dr. Funk will come in and say hello, and then you'll go back into surgery. When you wake up, you'll be in the recovery room. You will have Swiss therapy gel mask on the eyes. You'll want to use that for the first 2 days. You'll place one of the Swiss therapy in an ice bath, and the other one will be on your eyes. You'll have cast and tape on your nose as well. We ask that you do not get that tape wet. You do not mess with the tape. Try to keep it dry. You'll have a drip pad underneath your nose as well, and it's taped to your cheeks. We will supply you with a nasal drip pad holder. This will take the place of that tape holding that drip pad up. You will change into that when you get home as not to tear up your cheeks with the tape. Go straight home from surgery, get in bed, and stay elevated. We ask that you start your anti-nausea medication, drink some broth, and take a pain pill. That first day, bed rest. You're only getting out to go to the bathroom for that first day. The next day, you can slowly walk around the house some. Now I want to talk about the most important thing to take away from this video, and that is bleeding. This will alarm you and the person taking care of you the most. If you are changing out your drip pad every 5 minutes to every hour, this is normal. I will repeat. If you are changing out your drip pad every 5 minutes to every hour, this is normal. When you first get home, it may be every 20 to 30 minutes, and a few hours later, it may bleed more. This again is normal. It is just the local anesthesia wearing off. Stay calm, stay in bed, take your pain pill, a Benadryl, and an anti-nausea medication. You may have clots that you can see in your nostrils that will be there that night of and the next morning. You will address this with your cleaning the day after surgery. No throat clearing, no nose blowing, no breathing through the nose, no nose picking, and try to sneeze with your mouth open. You may have a sore throat after surgery. You can do ice chips, cold fluids, and any kind of popsicles to help with that. Okay, you got through the first night, and now you're at the next morning. This is where you'll start your cleaning. You'll start with a saline solution, follow with peroxide and Bactroban. Now we'll go over the cleaning. You'll remove that drip pad day after surgery to start the cleaning process. I'm gonna play pretend here and act like this is your saline solution, and this is going to be the tip applicator it comes with. So again, day after surgery, you'll remove that drip pad. You're gonna place that little applicator right inside the nostril. When it goes in, it should really go no further than the middle of your nostril inside. Tilt over a sink and hold that button down for about 4 seconds. It's gonna spray right up and go directly out, so we're not using the nose. It's just going to be rinsing. You'll do 2 sprays each side 10 times per day. Then you'll follow the cleaning. So peroxide and Q-tips. You'll get the Q-tip nice and wet with peroxide. It's gonna go inside the nose. So once you place it inside the nose, you should really still see where the cotton meets the bar sticking out of your nostril in the mirror. I want you to make a nice circular motion, just like this. Focus on that tip area. You wanna make sure there's a lot of stitches, a lot of crusting develops there. You wanna make sure you're getting the whole circumference of the nostril. You will then follow with the other side of the Q-tip with Bactroban ointment, the exact same way. So again, peroxide and Bactroban inside the nose twice a day. Then you'll get a brand new Q-tip with more peroxide, and you'll clean the stitch line the exact same way. So you're gonna have dry blood on this stitch line. You can't miss these stitches, they're blue. So you wanna get all of that dry blood off, making sure it's nice and clean. If you have stitches on the sides of your nostrils, you wanna make sure you get them as well with the peroxide, and then follow with Bactroban. So again, peroxide and Bactroban inside the nose twice a day and outside the nose twice a day. You can take Sudafed during the day and Benadryl at night. After you clean it for the first time, please take a photo and send it to our office. You'll want to focus on the tip of the nose. Things to look out for: intense redness, pustules, crusting, or blisters. If this ever occurs, please reach out to our office immediately. Again, make sure you share this video with the person who's taking care of you prior to the pre-op so it can better assist your recovery.